Once the cage dressing has been completed, you can add a light, loose layer of absorbent gauze on top. This layer should be light enough that air can reach the cage underneath, even if the absorbent gauze is soiled. Of course, the gauze should not be allowed to remain soiled for long, for otherwise the maggots could suffocate or drown if the wet outer gauze is not changed every 4 to 8 hours and whenever soiled. If the gauze is not wet after 8 hours, the wound tissue may not be moist enough to support the maggots or facilitate their production of digestive juices. In that case, moisten the wound with sterile water or saline before replacing the fresh gauze pad, or place over the cage a slightly moist gauze pad instead of a dry one. The dressing should be removed after 48 to 72 hours. Most of the maggots will be fully matured and satiated at 48 hours. Once satiated, they will spend the rest of their time in the wound, trying and prying to escape. You can tell that the maggots are ready to be removed because they will now be the size of plump rice, clearly visible just underneath the porous roof of the dressing. As before, you will want to have all of your supplies by your side when you remove the maggot dressings. Wet gauze pads will help you clean up the maggots easily. I like to wet one set of 4x4 gauze with hydrogen peroxide and another set of pads with water or saline. Once I have everything set up, I carefully loosen the dressings from the skin so that I can later remove them quickly and effortlessly. Once the dressings are loosened, with one hand I peel back the dressing like a banana peel, while I wipe up the maggots with the wet gauze pad in the other hand. As I peel back the dressing, I sandwich the maggots between my two hands. Then I dump the entire lot into the rubbish bag, often without losing a single critter. I like to wipe first with the hydrogen peroxide gauze pad, as it may kill some of the residual bacteria and may also stun and slow down the wandering larvae. Then I wipe or irrigate the wound some more using the water or saline-soaked gauze. Remember, maggot dressing waste is infectious waste, just like any other wet dressing waste. To minimize the risk of these mobile fomites getting loose, you should double bag them, tying each of the 2 bags securely. Be sure that this waste is removed from your facility that same day. At this point, careful inspection of the wound will reveal whether any additional maggot treatments will be necessary. Non-planar wounds, like toes, heels, and stumps, are particularly difficult to dress because most netted fabrics will wrinkle as they wrap around the surface of these wounds. We recommend using nylon stockings as the porous layer for such wounds. The stocking can be sealed proximally and distally to a circumferential strip of hydrocolloid. Today, thousands of wound care centers are using maggot therapy to treat a wide variety of non-healing wounds. These dressing methods can be modified to meet the needs of the individual therapist, patient, or wound. For additional information, literature, or training, contact the Better Foundation. If your facility does not have a procedure and protocol for performing maggot therapy, one may be obtained through the Better Foundation or downloaded from the Better Foundation website.